Interesting fact about electrophysiological study, EPS, is that it's a diagnostic tech where the doctor's primary goal is to intentionally provoke and start the patient's the most dangerous and potentially lethal arrhythmia. Unlike a ECG or a Holter monitoring, which passively wait to catch an arrhythmia, an EPS is an active, proactive investigation. An electrophysiologist, a litmologist, an electrician of the heart, threads catheters with tiny electrodes into the heart. So they then use these catheters to send out controlled electrical impulses, especially teasing, pacing, and stressing the heart's electrical system in a very specific sequence to try and induce the clinical arrhythmia. The patient is brought to the lab because they are terrified of their arrhythmia, and the doctor's job is to start the exact arrhythmia in a controlled, safe environment. An EP lab is essential in operating room and the ICU combined. So it's a controlled catastrophe. It's a deliberate recreation of a potentially life-threatening event. So the goal is to see the enemy in action. Where does this arrhythmia start? What is the mechanism? How fast does it go? And this is the only way to try to truly understand it. It exists or not. It's ultimate diagnostic and therapeutic tool. The story doesn't end with provocation. Once the dangerous arrhythmia is induced, the EP can immediately. So, map it using advanced 3D mapping systems to find the exact location of the short circuit. So, terminate it with pacing or a small shock if needed. Cure it. In the same session, they can often perform a catheter ablation using radiofrequency, HIT, or cold energy to destroy the tiny piece of abnormal heart tissue causing the problem, permanently curing the arrhythmia, permanently, definitely. So it's a test of courage for the patient. The patient is often awake under light sedation and can feel the arrhythmia start. It requires a profound level of trust for patient to allow doctor or to intentionally trigger the very event they fear most. No trust we all need. Stay blessed.